Maryland's first open enrollment did not go as anticipated. The launch of a fully functioning digital marketplace was more challenging than we and many others expected. We knew if we were going to be better prepared for the second open enrollment for 2015 coverage, we had to make a major change.
On October 1st, 2013, within moments of the 8 a.m. launch of MarylandHealthConnection.gov, the website crashed. Calls to the Consumer Support Center spiked. The system was so slow that many applications took hours to complete or were completely abandoned. By the end of that first open enrollment period on March 30th, 2014, nearly 68,000 consumers had signed up for a private qualified health plan, well below expectations.
The second open enrollment was just 7 months away. Time was not on our side. Maryland residents were depending on us to have a fully functioning state-based marketplace so they could compare and purchase a health insurance plan for themselves and for their families.
In a state 310 miles away, the Maryland Health Benefit Exchange Board committed to abandoning its initial marketplace technology and to implementing Connecticut's solution, APHSA Health CT. A solid business plan and strategy was needed to assure the new system had the functions it needed in time for the second open enrollment, known as OE2. But successfully adapting the Connecticut model was complex. It could take many more months than Maryland had available. A daunting task it was! With the decision to implement a new marketplace, the MHBE had to capitalize on the opportunity to rebuild trust and rebrand its website. The MHBE launched an extensive marketing campaign for the second open enrollment to identify opportunities for collaboration and partnerships with organizations.
The MHBE needed a system that Maryland residents could rely on, and the residents needed a reassurance from the state that the system would be available for any on-demand search for the services. The MHBE knows we could not do this alone.
Starting a project of this size and magnitude under an abbreviated timeline would require significant coordination across stakeholder groups.
In order to be ready for go live, the team would primarily focus on the critical functionality that is required for the open enrollment. That means if the functionality is not required for open enrollment, that would be prioritized for the future release. Also, to mitigate any risk, the state made a conscious decision not to convert the data from the old HICS system. While this was not ideal, Marylanders were counting on the state to have a fully functioning system ready for the next open enrollment period, only 7 months away.
Transferring the Connecticut solution to Maryland provided some distinct and immediate advantages that propelled the MHBE toward achieving its goal of having a fully functioning, state-based health insurance marketplace in only 7 months. The MHBE team reviewed, updated, validated, and tested 2,500 plus business rules, 675,000 lines of code, and worked 133,858 hours in preparation for OE2. In the end, Maryland realized a 95% increase in the number of qualified health plan enrollments from OE1 to OE2. Now Marylanders can utilize a reliable marketplace to compare and shop for health insurance options, and the system works. It created an opportunity for an unprecedented collaboration between Maryland and Connecticut.
The success of the second open enrollment would not have been possible without the help of everyone involved. To date, we have successfully enrolled more than 125,000 people in a qualified health plan and about 400,000 in Medicaid. But our work is far from over. We're working diligently to improve the customer experience and be ready for the next open enrollment that begins November 1st. And one more thing.
Thank you, Connecticut.